At the end of 7 days, there are such dramatic changes in the microbiome that our AI, our computers that have algorithms to predict diseases, say diseases like anxiety or cancer or PTSD. The machine learns when a person has PTSD, there's a very specific microbiome they have, very similar for cancer, very similar for PTSD. Okay, so you can predict more than 70, 80%, 90% when a person has a health condition by looking at their microbiome. At the end of 7 days, the AI, the machine learning couldn't predict the algorithm couldn't predict it at all. It couldn't tell if the person had the cancer any longer. And there were so many probiotic microorganisms that were upregulated for inflammation, to reduce cancer, for cancer response to treatment. 7 days?
Wow.
7 days. And I said to one of our research team, well, what do you think it is? And one of the researchers said, I don't know. And the other researcher looked at me and he said, they're not the same person. If they were the same person, they'd have the same microbiome. And in 7 days, they're a different person, different microbiome. But the microbiomes that are being created, the competition for healthy microbiomes are squashing the microbiomes that control a lot of diabetes and inflammation and cancers. And so we showed this data to one of our neuroscientists on the team, and she was like, excuse me, like, she couldn't even compute how all of these changes would have such a dramatic effect on the microbiome. So I want to be very clear that, number one, I'm not saying this. I'm not saying that meditation somehow has an effect on the COVID virus or on cancer regulation. I'm not saying that. The data's saying that. And I keep telling the scientists, I can't believe this is the truth.